This is Marty Chizek from Charism Home Care and Eldercare Services here at 4905 Main Street in Downers Grove. And these are video blogs to help those of you who are caring with seniors and experience some stress have more information about issues that can keep that senior safe and keep you less stressed. Today I'm going to talk a little bit about discharge planning and the issues that can happen when the discharge planning process goes awry. I'm going to talk primarily today about hospitals, but that discharge planning process goes from leaving a nursing home as well. So, in fact, worked with a patient today who had a surgical procedure, who is ready to go home and was in intensive care and now has moved to the medicine floor. Talked to the discharge planner social worker yesterday, gave her the details of what was going on, called again today, gave the details to the social worker, and lo and behold, what I found out is these two social workers had not talked to each other. They had not reviewed each other's documentation. I had a home care agency that was going to come out and see this patient to follow up on the wound that she had since she had surgery. I've got physical therapy saying one thing, I have occupational therapy saying one thing, I have the social work discharge planner saying one thing, I have the home care nurse saying something else, and I have the nurse on the floor with different orders, and the order from the physician is discharge when the patient is stable. And that's what happens, and that's how things get awry. And so what happens anymore today is when one goes to a hospital, often it's not the primary care physician who follows up while the patient is hospitalized. It often is what we call a hospitalist. It's a physician who works only in the hospital and writes orders and follows the patient. And that's great because they have special skill set, but they often do not know the long history of the patient. They may not know the medicines they were on beforehand. And so it becomes a real challenge to make sure that we keep all those balls in the air, because medications are a prime issue for negative outcomes for seniors. So we want to be really sure, those of you that are working with families, that you bring in all the medication prior to the hospitalization, and that you make sure that everyone is on the same page with what's going on, because there are multiple providers and we each have our own job to do, which is important, but often because of the complexity of the care we have, it's difficult to keep the information flowing and not have issues with some distortions. So be your own best advocate and be careful anytime you're being discharged from the hospital, making sure that information is correct and accurate. So come back and visit again. Marty Chizek with Charism Home Care Eldercare Services. Bye for now.